for our intensive LCGs as well as our communities of practice, we are expecting that agencies apply versus individuals. And so when I say that, what I mean is that the application will be an agency application, and it will need to include at least 3 members of the agency staff, 1 person which is an agency decision maker, hopefully persons who are part of the program staff, and then staff members who have a deeper understanding of data analysis. And as we think about the configurations, or as you think about the potential configuration of your team, that team may just be specific to your agency. Depending on what your focus is, you may choose to involve your state association. We even have state associations who have formed teams and then worked with cohorts of other agencies within their state, the same with our state CSBG offices. And so the point is that everybody is welcomed and has an opportunity to participate, and as it relates to that configuration, it's important that you apply as an agency unit. And so the other things that we want to call out, which we've already kind of touched on, but we want to emphasize for you, are the benefits, because there are so many benefits to participating. And in addition to having that dedicated space for peer learning and peer sharing, that specialized technical assistance, access to subject matter experts, and we just have a wealth of experts that you all will have an opportunity to tap into. So, for example, this year, one of our new subject matter experts will be FSG. They focus specifically on collective impact and have contributed a lot in that space. But there are several other organizations, from Prosperity Now, the National Alliance to End Homelessness, and other individuals that you all have known throughout our work, who will be contributing to the body of knowledge that will hopefully build agency capacity. And so we've also talked about, that opportunity to enhance your strategies or your service delivery approaches, and then the ultimate benefit for the larger network. And so the next thing I want to emphasize on the next slide is that participants in our intensive and learning community groups and our communities of practice will be required or expected to attend regular meetings. There will be specific group meetings that happen on a monthly basis for the intensive learning community groups. In addition to that, there are national webinar presentations that group members will be assigned to participate in, and they can listen to those live or access those on demand. And there will be assignments associated with participation in the intensive learning community groups and the communities of practice that agencies are expected to complete in order to move their work forward. I've already spoken about the time frame, but I will emphasize that for intensive groups, it's for 1 year, and for the communities of practice, it is for 18 months. And so at this time, I'm very excited to now transition to what I call transformation stories, because you can listen to myself and Jeannie and Jarl all day, but there's some of you out there who still don't believe us. And so as a result, we have called on some of your peers to bear witness of transformation as a result of their experience within the learning community. And so I want to highlight a slide from your colleague, Toni Stottlemyre. A lot of you know her. She is Executive Director at Community Action Incorporated. She was a member of our Bundling Services to Improve Outcomes Learning Community Group during the last iteration. She is highlighted in our Anti-Poverty Practice Series publication on bundling services, and also a national webinar presentation that was presented as well. But the interesting thing that I would like to call out about Tawny's agency, Tawny's agency is that in their initial assessment, they felt that they were in the very early stages of thinking about bundling services and doing the work. But the key for her agency was that they were ready to do the work. And so even though they were in those early maybe toddler or baby stages in terms of thinking about bundling services and doing the work, like I said, they were ready to do it. And through that process, even though maybe they didn't feel like they were the experts, they were able to learn a lot as a result of their experience and move their efforts forward, but also found that they were indeed able to be contributors to other peers and the larger network. And the thing I would highlight about what she said, she wrote to us, is that our consultants, talking about the subject matter experts, were fantastic resources, and we appreciated their free-to-us expertise. Can't beat that, I'm just telling you. So then at this time, I am happy to then transition to another one of your colleagues who is going to bear witness for us today, and that person is Rand Clark. He is at the Douglas County Department of Community Development, and he is a community of care navigator. So at this time, I'm going to just ask Rand if he would share a little bit with us.
Hello, everybody. Thank you for letting me have a chance to talk. Thanks to Tiffany and the team at CAP that ran a really wonderful learning community for us last few years. I was a member of the Bundled Services Learning Community. I was actually encouraged to join that community by Jarl a few years back at one of CAP's national conferences. Had a chance to talk to him about some of the things we were experiencing and some of the challenges that we were facing. We were in the beginning stages of building a bundled service approach, or an integrated care approach to helping address poverty in our community, and we're really wanting to take the next steps in terms of going to scale and serving more people, integrating the use of data, expanding our program and what we're able to do. And Charles said, hey, you should join a learning community group. It would be really helpful for us locally to engage with subject matter experts and to hear from some of our peers across the country. And so with his encouragement, we signed up for the learning community and really entered into that season a couple years ago wanting to ask some questions about how we could take a small project that was a pilot project. We were serving about 20 families, and how could we double, triple, quadruple the size of what we were doing. And the big thing for us was how we could integrate the use of data systems. And so we entered the project thinking that that's what we were going to be working on. And through the learning that we obtained from listening to our peers and from learning from them, from the subject matter experts, was actually so much more than that. We really were walked through a very intentional process over the course of that first year that caused us to look at things like our theory of change, our frameworks of care, and really allowed us the space and the opportunity to dream up and to create some new systems and new approaches. And we had a sounding board in our peers and in the experts to say, hey, what do we think about this? Will it work? And for us, it really caused us to rethink some of our entire strategy and our entire process on how we bundled services. And today, as a result, I think we are able to much more effectively serve those we are serving. We've gone from 20 families to almost close to 60 it will be this year. In 2017, we're utilizing community data systems, and we're coordinating now this bundled work across 13 different agencies in our community. And so we were really excited about the opportunity. We had a tremendous time, not just from what we learned, but also the people that we got to connect with. It was great to get to know some of my peers across the country and to learn from them, and really to develop some friendships as well. Last thing I wanted to say is, the learning community group that we were a part of for those 20 months was a fairly big time commitment, but it was something that I felt was really valuable. It's the old saying that the more you put in, the more you're going to get. it out. And for those of us, I think, that were really impacted in a positive way by the learning community experience really was the agencies and the people that really invested the time and the energy and the effort into not just doing the homework and not just doing the work, but really applying it and really taking a good critical analytical look at our organizations and our programs and saying, how does this apply, what can we learn, and what can we do to become better and ultimately be a greater champion and a more effective provider of care to those that we are serving on a daily basis. And so if this is something you are interested in, I'd be happy to answer questions. You are welcome to contact me, shoot me an email in the chat, and I'd be happy to contact you. We'd be happy to answer your questions, but also would encourage you to jump in, dive in, and invest your time and energy into getting better every day at what we do so that we can have a greater impact across our community and across our country. Thanks for the chance to share, Tiffany.
Thank you very much, Rand. Thank you very much. So the other thing I will mention is Rand and his agency are also featured in our anti-poverty practice series, so definitely check out the newest publication on bundling services to improve outcomes case study. And so very quickly, I'd just like to highlight for everyone the criteria for being accepted into our intensive LCGs and our communities of practice. And so to be considered for our intensive LCGs, applying agencies basically must show evidence of implementation or practices related to the respective focus area. And so if you are an agency who is trying to just figure out what is integrated services or what is financial empowerment, however, there haven't necessarily been any steps that you've taken to sort of think through what that plan for change or implementation might be, it may be that the open learning community space is the space for you in that we are looking for agencies who have not only begun to think about the approach, but have made some efforts to pilot or move that work forward within the agency, and so would therefore be ready to focus more specifically about implementation of an enhancement related to that work. The other critical part of consideration for us is that the agency applies to be members of our intensive and our community of practice groups. And so with that said, our requirement is that the agency's leadership affirm and sign off on a commitment for the agency to participate, because the intent is that as a result of participation that the agency would basically make some changes or engage in a transformation that has programmatic implication, but it also just has larger organizational transformation implications as well, and we need everybody to be brought into that process. Additionally, this whole notion of connecting the dots back to data tracking and analysis is critical, and so we want to hear from agencies who participate, just their thinking and efforts that they have made in that space. And of course, as a result of participating in the groups, we will be able to provide some additional technical assistance related to that whole connecting back to data analysis as well. And for our prospective communities practice members or our whole family COP, there again, there has to be that evidence of having piloted programs or strategies related to whole family approaches and that advanced knowledge of service integration or bundling services or two-generation approaches. And so especially this group is open to everybody to apply, but I do want to put out a plug for some of our previous members of our learning community, especially for some of those agencies who have really advanced your work and you've been doing this work for several years. This may be the opportunity for you, and we just invite you to attend that special interest session that we've already mentioned that will take place next week to learn a little bit more about that. For the intensive learning community group, we are targeting about 10 to 15 agencies to participate in each of those groups. Jeannie has already mentioned that within the community of practice, the target is a solid 10 agencies who will be designated to participate. The other thing is that that agency team that applies is really viewed as the core team for engagement within that learning community group. So that they're responsible for making sure that the agency attends all of the meetings, gets all the assignments done, but also is responsible for communicating back to the agency's leadership and the larger organization around key learnings and knowledge that can move the work forward. Next, to talk a little bit about the timeline, of course, we are participating in the kickoff webinar today. I will emphasize that the applications to apply for the learning community go live immediately following today's webinar. Those applications are due on January the 12th. Our team will review those applications, and we have committed to notifying persons or agencies who have been accepted into our intensive learning community groups as well as our community of practice by the end of January. I think that date is January 30th. Additionally, I would say regarding our open learning community groups that everybody who applies for an open group is accepted. I'll say it again. Everybody who applies for an open group is automatically accepted, and so there won't be any additional expectation of you to apply, and that then enables us to be able to start your learning journey in January of 2018. And we are anticipating starting out with our health intersections as well as our results at the community level open groups during that January time frame. We have already mentioned that there will be a whole family institute here in Washington, D.C. in June of 2018, and you'll be hearing from our team within the next week or two with more details pertaining to that. There's a cost associated with it. Agencies will have to register, and we just want you to go ahead and begin thinking about your potential involvement in that, and it will be held in conjunction with one of our other communities of practices convening our Rural Impact Group, because that group will be closing out its work, and it will be a wonderful opportunity for you to hear from peers from the Rural Impact Project about best practices and lessons learned pertaining to implementing the two-generation approach in rural and tribal places.